I'm going to use this one. And if you can't hear me, please let me know for now, and maybe Rich will get the other one updated. So I think at this time we're going to start the meeting, if everybody's okay with that. Welcome. Tonight is Wednesday, August 25th. Welcome to the high school auditorium. And at this moment, we are going to call the meeting to order and stand for the flag salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Do you want to stand for that?
Only what's convenient
Rich,
for them.
if you're able to provide the stand, if it works, for Wendy, that'd be great.
Otherwise, I might be belting out some karaoke soon.
Thank you.
So at this time, we have a hearing of visitors section. If anyone would like to speak, now is your time to do so. Once you come to the microphone, if you can just announce your name and your street address, that would be great.
Hey everyone, Mike Kaloje, 38 Lantern Lane. Lost a lot of sleep over the past couple of nights with everything going on. First of all, I appreciate everything you guys do. Don't ever think otherwise. As a volunteer on a town board, I know what it's like. Nothing's ever personal. I was trying to come up with the right words, especially now since Desi's already decided it's kind of a moot point. So I just wanted to read this quick, maybe make a positive out of a negative. So I understand the committee's hands are tied due to Desi's recent decisions made yesterday. That being said, I'm going to try to turn a negative into a positive and make this request to you all tonight. Instead of focusing so much on masks and distancing and all the buzzwords everyone loves to throw around these days, I'm asking you all to start focusing more on what the Abington school system can do to improve the mental health in our schools. I've been a first responder for longer than I'd like to admit, and a paramedic for close to 14 years. When we bring people to the emergency rooms, you don't see very many people on respirators or dying in their last breath. What you do see, however, is hallways full of people with depression, mental illness, or addiction. Some of these people spend days waiting for a bed in a facility because they just aren't there. Sorry. During this pandemic, we lost sight of an even bigger issue, and that's mental health. The lockdowns isolated many children. Some felt trapped in lousy living situations. Sadly, many kids were told they would be responsible for killing Nana and Papa if they didn't wear a mask. Sorry, not sorry, but that can do a lot to a little kid's brain. Abington has had its fair share of COVID patients, but quite honestly, I lost track of the number of young teens and adolescents we've been called to deal with due to either depression, mental illness, and just acting out because, let's face it, it's been quite a year. So in closing, I'd ask you all to worry less a little bit about masks and put more of your efforts into finding more programs for mental health for our students. Thank you.
Thank you, Mike.
Thanks, Mike.
Hi there. Please just state your name and address. Yep. Thank you.
Hi, my name's Mike McDonald, 3 Pinecrest Road in Abington. I'd like to basically talk about the absolute statistics that people don't talk about, which is the number of deaths, how tragic they are amongst 0 to 19-year-olds. We would think from listening to the news that children are dying everywhere. We know that's not the case. We need to start pushing back. Our children are losing their any dignity they have. They're walking around like in petri dishes in their mouth. I think as time transpires, we'll see much more, like we were talking about with depression, suicide, drugs. Those numbers are skyrocketing. We care about masks and we don't care about pushing back when we know that our children are good. Now, as a father, I would never send my son or daughter to school or anywhere that I didn't feel 100% comfortable for. Now, I don't think the school, publicly, any government should tell me what I should do to for my children. I'm protecting them. We know the numbers, but yet we don't fight back. I think people should be, I know people are tired of it, and I know that, like you said, this is a moot point, but the depression and the suicide are astronomical, and that is what's going on. Not masks, not kids dying of COVID. Social distant, there are plenty of studies that say the masks don't work, much like they say they do work. So we've seen the CDC come out and say, asymptomatic, it's damaging our children. It is killing them slowly inside. But unless we push back as a town committee, or whatever it is, individually, we're going to watch our children continue to descend into a mire that we cannot get ourselves out of. I'm asking you, everybody, to take a stand. I mean, it's just clear. 400 deaths amongst 0 to 19, of which the CDC themselves say 35% are not related to COVID. So those numbers out of 75 million children. 75 million children. I don't know. I mean, we got to start really looking at the issues that matter. Thank you.
Thank you. Thank you, Mike. Appreciate it. Would anyone else like to speak? Can you just state your name and address, please? Thank you.
My name is Beth McDonald. I live at 45 Spruce Street. I am curious as to what's going to happen to children, a disciplinary action against children who will not comply with the mask mandate. I want to know what's going to happen to them. Julie, can you answer that for me, please?
I believe it'll be in the presentation. Maybe we'll talk about it. I don't have the answer to that. I don't have
So it's not hypothetical anymore. It's actually something we can discuss, because when I spoke with you on the email, you said it was just a hypothetical thing.
right, because there was no mandate at that time.
Isn't this whole thing hypothetical? Wasn't this whole thing hypothetical when everybody tried to discuss it and ask for questions?
Beth, can I actually have some information for you on that?
Okay.
So probably around like 5 o'clock, 5:30 is when I read the DESI guidelines, and I immediately contacted Peter and said that the guidelines state that disciplinary action will be at the local level.
Okay.
And I let him know that since Chris and I are on the policy subcommittee, that we would need to have a meeting as soon as possible to discuss what our disciplinary action looks like at this time,
Okay.
as well as what it will look like when it comes to masks.
Okay.
So if you can just give us a couple of days to get something going so that we can make, between his schedule and mine, I mean, I can meet as soon as possible, and I know Chris is usually pretty open too. So as long as we just have to get things on the books the right way, so we have to announce it, it has to be 48 hours up saying that we're going to have a subcommittee meeting, and then we have to discuss it with our board to make sure that they're all on board with it, and if not,
Does there have to be a vote?
it would have to be a vote, yes.
And what
right?
if the vote
Yes.
doesn't go through, then what happens?
Well, the vote would go through no matter, like, it would, I can't tell you right now. I'm sorry. I wish I could.
Absolutely, I know.
All I can say is I will, and I'm sure this whole committee will just have the best state of mind for our students. And I'm going to try to approach this as easily and swiftly, basically, as we can to make it easy for the students and parents. I don't know how the rest of the board would vote. I don't know exactly what's going to come about it. We basically have to meet and see what's up.
I'd
first.
just like to voice how disgusted I am with the way I was treated in emails regarding one of your committee members. When I asked for answers to questions, hypothetical questions, as I was told, I received nothing. I just want to let you know I did forward that to my son's lawyer as well, his advocate. I'm just disgusted with the way that this has been handled and treated because no questions were answered regarding specific committee meeting members. And if anybody needs to have that documentation, although I'm sure you all do, because I know I CC'd all of you in it, I just want to let you know that I'm disgusted and I actually demand that she resign because this is ridiculous with the way this is being handled. Parents are scared, they want to know what's going on, and that's the type of email I get. I refuse to have a conversation regarding a hypothetical situation about my son who was on an IEP. I wanted to know what was going to happen to him, and she refused to answer me.
I wish that the,
Can I just comment that I refused because I didn't have an answer? That's.
You simply could have said that. I'm not quite sure what's going on right now, Beth. I'll get back to you and let you know. Instead of being completely rude and telling me that you refuse to answer my questions about my son who legally is represented in Abington schools, Peter Schaefer knows about it, I'm disgusted with the way you act towards people, and I think you should be removed.
Okay, thank you. Seriously, that.
thank you, Beth. Would anyone else like to speak? Peter?
Yeah, I'll just say that we received the information from the Department of Education about 3 hours ago. It was at 3:32. And so there are going to be a lot of questions tonight that we don't have answers to. So we've tried to provide updates to people as information unfolds. And then the problem, if we get ahead of the information and we don't know an answer, is that we create even more confusion. So just as soon as we can, we try to get information that's solid to people. And the fact that we're meeting the week before school starts and we're rolling this out the week before school starts is wrong. It's just wrong. But that's where we are, and that's how the information is coming out. And so tonight, you're going to get as much information as we have, and you're going to hear me cut short on things that I'm not sure of, because I don't want to give you bad information. Let's face it, no matter what side of what issue you're on these days, there's lots of bad information out there, and we don't want to continue that practice. So there's some things we won't be able to answer tonight, or couldn't answer last week, or till 3 hours ago.
Thank you. Anyone else like to speak before we close out this section? Come on up. Thank you. Hi.
My name's Christina Cool. I live on 989 Plymouth Street, and can you hear me?
Yes, thank you.
All right. So I did jot down some notes just because there's just so much information and so much I want to say. So I'm just going to quickly go over some things, and then I'll go through my personal, my experience with my kids, okay? So as far as masks negatively impact communication, which is obvious. Masks make it harder for those with allergies, asthma, autism, all sorts of learning disabilities. It's just makes things a lot harder for them, as well as it's very difficult. I worked in a lot of the TLC rooms, and it's very hard for those kids to keep the masks on. I mean, it's kind of, you got to pick and choose your battles when you're working with kids in special ed, and wearing a mask is definitely not a battle that's worth fighting, fighting for with a student, over a mask. So masks can lead to negative body image and create an opportunity for bullying. The reason I say that is because, you have that divide with the kids. They might be like the mask police, like, oh, so-and-so didn't wear his mask, or and that's just, it's not good either. You don't want the kids to be, saying one thing or the other. If one child's wearing it, the other one's not. It's just, so then the other thing about the mask is the loss of normal socialization. How's this going to affect the kids in the future? I mean, this, as much as I know that it's trying to be normalized, this is not normal. This is just not normal. Like, enough is enough. And I really feel like people have been very, very patient the past year and a half and have done their due diligence. And then there comes a time when you need to question what we're doing. And eventually I have to say, you know what, is this even working? Does this even make sense anymore? I mean, I feel like It just hasn't. So with the kids' mass, I'm kind of going to go off track a little bit. I was a COVID relief building sub at Beaverbrook this past year. Absolutely loved it. Staff's amazing. Students are amazing. I really enjoyed my time there. And they did a wonderful job trying to deal with all the restrictions. But when I was there, you know, I worked with the kids all day, and their masks, if they work, you have to wear them correctly. And I have to be honest, the kids aren't wearing them correctly. They got a sneeze, it's all wet. I mean, literally, there'll be kids with like a big wet, circle on their mask, or they dropping it on the floor. None of the kids are wearing them right. So I think we need to be a little honest with ourselves that they're little kids. They shouldn't wear it, you know? So they're definitely being worn incorrectly. And I just feel like it's just so much information that I don't know, I don't even know if I can cover all this. But, you know, even with the kids, when you're washing the mask and you wash them over and over again, they're not as effective, the cloth masks. I mean, so all right, so I'm going to stop with this part, and then I'm just going to say one of my sons has a syndrome where he has a speech delay, and this is directly is going to impact him. He can't see the teachers when they're talking, and I just don't believe that this is the way that we should be teaching our kids. Last thing I remember at Beaverbrook, numerous times I'd be working with the kids, and they're playing with their mask, so it breaks. They would literally go like this, like scared. Like, I'm like, what's wrong, honey? What's wrong? My mask, it broke. I'm like, oh my God, it's okay. Like, they were so fearful, and that will stick with me forever. And it's just not right. This needs to end. And I absolutely disagree with the mask mandate for these kids. I think we need to kind of move on. So I'm sorry I got a little sidetracked, but I'm kind of done with it.
Thank you. Would anyone else like to speak? Come on up. Hi, if you could just state your name and address.
Lauren Sanderson, 21 Buckboard Lane.
Thank you.
So these are 2 of 4 of my kids. I have a 3rd grader and a 1st grader. I have a 3rd grader who was very excited when he received the email. We received an email saying it would be recommended, but he wouldn't have to wear a mask. It made his day. Then I had to destroy him when I had to tell him he couldn't wear that. He had to wear this mask now that has been very uncomfortable for him for the last year. I have another kid who I have been in and out of urology for the past year due to severe dehydration. It has been bad, and it's not getting better. We've been pushing it through the summer, and he's been doing a lot better, but I don't know what to do now. I sent a letter to the school, and he was supposed to be able to drink water frequently. He had a potty watch on to make sure he was drinking water frequently. He was still coming home, well, practically full water bottles, and he wasn't getting enough chances. And I do think part of it is the mask on his face. He forgets to take it off and drink water, and that's a problem for me. And now I'm scrambling to figure out what to do. I'm talking to his urologist, and I don't know what to do at this point because he's not drinking the water, and it's really impacting him. And I'm concerned about it. And at that point, there are so many parents with similar issues to me. And it's frustrating that we're all forced to do the same thing when I think I know what's best for my kids. And somebody who doesn't know my kids is telling me what to do with my kids. They look at him and they don't know he has an issue. Same with many of those kids out there. But you're telling them they all have to do the same thing, and it's impacting him, but it doesn't matter because he has to conform to what everybody else is doing. And that is frustrating, and I don't know what to do. And now I'm a week out from school, and I'm stressed, and I can't sleep because I don't have the right answer, and I don't know how to help my kids. And you're really making this difficult for us to help our kids. And I feel like now with the mask, is it ever going to go away? You allow the masks now, it's just going to keep happening. Are we ever going to let these kids walk around without a mask on? Are we ever going to let them see each other's faces? Because it doesn't feel like it at this point. And I mean, these are two of the faces right now that are struggling through this, and I want you to see those faces that you're not going to see come next week. Thank you.
Can I just ask, with regard to the medical issue that you've provided that's of, obviously great concern, and you may have already done this, but if you haven't, would you please make sure that you contact the nurse at the school building? Just, thank you very much. Yep. Okay. Obviously, we want to make sure that we've got a good communication loop with the nurse and the teacher so that, an appropriate amount of fluids happen. I'd want to get specifically into that, what happened last year. If you want to do that, I can. I'm asking just to make sure that we close the communication loop so that we can make sure your son gets hydrated this school year.
Thank you. Would anyone else like to speak? Okay. Oh, I have one more. Hi.
I was just like to ask if you can't answer.
Can you, I'm sorry, to,
Oh, I'm sorry, Daniel Delacourt, 1220 Washington Street. We just can't seem to answer basic questions. I don't know how we expect to move forward with a mask mandate if we can't even answer certain questions. I don't know if that's.
Is there, hopefully the presentation
Okay,
will
that's
answer
what
whatever that question
all right.
is.
I was going to wait, but I wasn't sure.
Yeah, and there are going to be questions that we won't be able to answer, but I'll give you as much as we can.
All right. I just wanted to say, through this whole thing, I've been working without a mask in Abington with about 50 guys there, and everybody's showing up to work every day. They might have a call up for a flat tire, but it's not coronavirus. And my daughter, she's been at home all year. She'd definitely like to come back to school, like she was saying as we were coming up here. Crying. I'd like to get her back to school, and one way would be to without the mask. But just throw that out there for you.
thank you, Daniel. We appreciate it.
Thank you.
Hi.
Nicole Emery, 16 Pond Street. What I have is pretty brief. Now the decision is out of your hands. I don't have much to say because I know we can't really change the mandate. But I want to just say how sad I am as a parent that my child does have to go through another year in a mask. I wanted to echo what the first gentleman said. As a mother and as a nurse, I'm very concerned for the mental health of our children and what's happening to them as a result of everything that's being said surrounding the masks. I kind of have a fear that we may soon see segregation among our kids, depending how these mandates just continue to evolve. It just gives me anxiety even thinking about, that something being down the line. But why I wanted to really come up here is to ask what the guidelines will be for the behavioral exemptions, and will we have that information before the start of the school year so that we can submit that and get those in and find out if they're approved, who will be approving them, will we have that information?
We should have a good part of that tonight, and
Okay.
anything that's left we'll get before we open.
Okay, thank you.
Thank you, Nicole. Would anyone else like to speak? Okay, so we will close this portion of the hearing of visitors, and we greatly appreciate everyone that spoke and has come out here tonight. I hope you all stay for the rest of the meeting so that you can hear what will be going on with any updates that we basically just got. So we were coming into this tonight. We had a presentation that was given to us over the last couple of days, and literally probably like an hour before the meeting started, it changed. So I'm not completely updated with everything in the presentation. I was updated with the last one, and I don't think you said that not a ton has changed, but there is more information than was in here before.
We took some of the information that was provided about 3 hours ago and worked that in. We also tried to just be clearer with the presentation, you know, swap the order of slides, things like that. There's no substantive changes from what the committee members really saw last night, this morning, to what they got this afternoon.
Thank you. Do you think it's a good idea to switch this and do the presentation first, or do the hearing?
Probably better to just not have that, to have that policy, like follow
Okay,
order,
perfect.
in my opinion.
All right, thanks. So at this time,
Can you explain the why we have to do this?
exactly,
Yeah,
yeah. So last year, we all had to, every school committee had to institute a policy regarding masks and how the school year would look and how it would be handled. So we did that. The last school committee meeting, to be honest, I wasn't really up to date on everything because my grandmother had just passed away. So when I came into the meeting, at the end of the meeting, I asked Peter if there were any new guidance from DESE regarding masks, and he said that that DESE dropped the mask mandate, that summer school would be recommended, but it wouldn't be enforced. So as far as I know, we didn't enforce it, but I'm not sure how many students actually wore masks during summer school, if any. So after that, everything was pretty much forgotten about. We just thought that, okay, DESE rescinded their policy, so we're all set to move forward. DESE came out on July 30th with new guidance, and at that time, I had asked the committee if they wanted to, I gave them a choice. Do you want to have a vote, or do you want to send out a letter because DESE states that we can go with their guidance. There's nothing saying that we have to have a mask policy in place. So the choice was to go with DESE because it really doesn't need to be in our hands at that point, you know? So it was best to get it out of our hands. And so that's why, and also a lot of the committee members were on vacation, and so we couldn't set a date. The next date that was set was the 23rd. So I was talking behind the scenes with everyone individually about how they wanted to approach it. We all basically decided that a letter would be best. And so we did that. The letter went out just so that we could get everybody on board of what's happening, you know, because everybody, they were in limbo about, are we gonna wear a mask or not wear a mask? So we did that. We sent that letter out, and then soon after sending that letter out, DESE came up with new guidance. And they said that they were going to try to institute masks by getting, well, actually it was Commissioner Riley, he was gonna try to institute masks by getting the Board of Education to give him approval. That happened, and so we still have our old mask policy in place. So tonight, for old business, what we're here to do is rescind the old mask policy so that we could be in compliance with DESE, okay? So,
Yeah, we basically have an old policy about masks on the books from last year.
Right.
That it's not a good idea to have policies in place that you're not using. It's, you know, so the committee's gonna consider removing it.
Correct. Do I have to read this old face covering policy?
I don't think you have to, people have access to it.
Okay. So the face covering policy is in our policy handbook, and it's under EBCFA. That's what the policy is called, if anyone's going to look for it. So at this time, we're gonna do things a little bit differently. As a result, so I'm gonna ask for a motion, okay? So as a result of DESI's latest guidelines implemented today, August 25th, I would like to get a motion to rescind the face covering policy noted as EBCFA from the 2020-2021 school year and follow the updated mask requirements as presented by DESI today. Would anyone like to make a motion?
I'll make motion.
I'll second it. Would anyone like to have a discussion? Yes. Does anyone, go ahead, Heidi?
Just, if I may, thank you to those of you who understand that this is now out of our hands. I could argue eloquently for masks. I could argue eloquently against masks. The thing that's concerning, though, is the amount of information coming back that we were finding that was just not accurate. People coming back and saying, well, in your next meeting, you plan to overturn that letter. If you have questions, please reach out. Reach out independently. I've spent hours upon hours on the phone. I understand all the sides. I think we all do. But if we can just remember in so many aspects, no matter if it's how we want it to go or not, it's only going to go better if we can be kind and be supportive. And I think that's just something we all across the board would like to see. So we all have family members who roam those hallways. Nothing in it for us to sink this ship right now. It's really only in everyone's best interest to try and weather this as best we can. And if you think we can be helpful, please reach out. But also just understand, not all the stories or information that's out there is in fact accurate. And we just ask that you kind of keep that in the back of your head. Thank you.
Thank you, Heidi. Julie? Danielle?
Yes, I'll take a minute just to say that first and foremost, I think from my years here that you've heard me say how much I care deeply about the health and safety of our students and staff, and I love the Abington Public Schools. I wouldn't choose to have my kids go anywhere else. I will push for unmasking our students as soon as we're able to do so, but what I do ask as we go through the next few weeks is that we not lose sight of the fact that everyone's trying to do right by their kids, and opinions differ, and everyone sitting up here hears you. We share your concerns, and we'll continue to do the very best we can given the circumstances, but just a reminder that everybody up here wants the best for all of our kids. It's really tough. Opinions differ, and if you can just as you communicate, as Heidi said, with any of us, just try to keep in mind that we're here listening and we care about your kids.
Thank you, Danielle. I'll go, if that's okay. Basically, what I have to say is I kind of already said it, but since I wrote it, I'll just say it again. So I'd like to clarify a few things and give a timeline of events. In July, after the CDC made an announcement about instituting masks again, a member of our committee asked that we have a meeting. I stated that it wasn't the right time. We should wait until DESI comes out with their guidelines because there's no reason to be in a position like we were last year and make decisions or get the community worked up regarding masks and guidelines until we know where DESI stands. Because we had members on vacation and wouldn't be able to schedule a meeting until July 23rd, I asked each member how they wish to proceed. We could vote on a policy, according to a source. We were required to vote, but after reviewing DESI and an attorney's guidance, I read it as we could follow DESI guidance and not vote on a policy. We would be better off as a community to get this out of our hands and into DESI's hands. So I gave each member a choice, vote or send a letter. The idea was to send a letter to get the community in the know, and then we would meet on the 23rd to talk about the logistics on how the beginning of the school year would look. Each member stated a letter was fine, but they were willing to vote if need be. While in limbo with the decision, to send a letter or not, and even after the decision for a letter was made, I received over 50 emails from parents asking for no masks in our school, or the right to choose. Once DESE put out their guidance, I received 2 letters from school staff asking for masks, and I received about 10 letters from parents asking for masks. DESE put out their guidance out on July 30th. The Abington Board of Health decided to host a meeting regarding masking our children in our schools for August 16th. However, they canceled it because our letter went out on the 13th. In the meantime, Peter discovered we still had our own mask policy in play, so we knew we had to rescind it, and that wouldn't be able to happen until August 23rd. Once the BOH caught wind that we were having a meeting and they weren't being asked to speak, they decided to host their own meeting an hour before our meeting was to start. The BOH made an announcement of a mask mandate, ensuing madness throughout our town, rather than stating consideration of a mask mandate. Then the bombshell from Commissioner Riley hit about asking the Board of Education for a mask mandate. Our Board of Health canceled their meeting yet again, and we postponed ours until tonight, when we could get final decision-making from the Board of Education and the Commissioner yesterday and today. So that's where we are at. And I just want to say that the Board of Health in Abington is under the umbrella of the Massachusetts Department of Health. We are under the umbrella of DESE. We control what happens in our schools, not the Abington Board of Health. The DPH has no mask mandate. If they did, we would have to follow the BOH, but they do not. So we're going to go by DESE's guidelines, because we have to, because we're part of the school system. I'm not happy about where we stand with masks in this state. I believe parents are wise enough to make the best decisions for their children, and more rights we give away to the government, the more they will take. I believe every parent in this room has the best intentions for their own children. I'm also, too, very afraid of depression, suicide, and the communication issues that will occur in our children. At this time, there's not anything. I wanted to come in here tonight with like my hands tied behind my back. I don't even know what to do. All I know is that I read DESE's guidance, and they said that the local level is when we would be able to decide the disciplinary action. So once we have our committee meeting for the policy, and once we discuss it with the other members, we'll be able to go from there as to how we stand with disciplinary. And other than that, that's all from me. Christopher?
Yeah, I'll go. Thank you, Wendy. Can anybody hear me okay? So part of this is when the conversation occurred with Wendy that she stated prior to the letter coming out from the superintendent. I gave her my opinion on where I stood, but I said that I wanted to be able to explain where I was coming from for everybody. I feel you all have that right to understand where I'm coming from. So at the time we talked, I was in favor of following the DESE guidance, which was strongly recommending masks. I'll tell you today, I do not agree with the mandate that was put in place yesterday. That said, I am a parent, I'm a member of the school committee, I'm asking everybody to follow it as best that they can. This is not a mandate that was put in place by this board. This board has not made any statement other than to stay with our original guidance of recommending the mask that DESE had put out there. Since then, we have had no say. We don't have the ability to override a mask mandate put in place by the Department of Education. That being said, I wanted to give some of the reasons why I felt the way I did then, and I still do today. So that's just kind of where I'm going to go with this. A couple of things before I start, though. I apologize, I usually don't go on, but I might go on tonight a little bit. So there's a lot of stuff on social media. We all know you can find stuff that'll support either side. A lot of it can be considered opinion. I don't have a problem with anybody posting their opinions on social media. There are a couple blatant pieces of information on there that I did want to correct because I feel it impacts the school department and this body in general. Number one, the Abington Education Association. At no time this summer has the Abington Education Association come back on anything that this school committee has put out. They have put no pressure on us to change any of our guidance. They've gone along with everything that we've said and never pushed back. There's a lot of talk out there that the union was driving things. The union was not driving anything. I wanted that out there. The other thing, There were statements made that this school committee cares more about the dress code of students than the health of students. That is a blatant and false lie that I don't appreciate being said. I wanted that addressed tonight. So it's my personal belief, ironically enough, that if you're eligible to be vaccinated, you should get it. That's how I personally feel. That being said, I don't believe it's up to this board or the Board of Education to put penalties on there for anybody that hasn't. I did email the Board of Education this is what my opinion trying to push against their approval. I did not state I was a member of the school committee. I just emailed as a resident and a parent. Until the state requires a vaccination of COVID to enter school like they do right now for measles, mumps, rubella, I don't feel this board or that board has the right to penalize those that haven't been vaccinated. Some numbers that I looked at that helped me come to the decision I did. During our summer school program, our extended school year program, 4 weeks long, we had 0 cases occur in building, correct? So that helped me feel better about what we were going to go with. The Eager Beaver program, 8 weeks long. Last I had asked somebody, they had 0 positive cases through 8 weeks. If anybody has any information against that, feel free, but that's the information that I had. Right now, today, we have 28 active cases in Abington as of today. That's from the Board of Health. And so that's the Abington state of mind. In the Massachusetts, the last data I could really find that was somewhat decent was for the period from August 1st to the 14th. In that time frame, there had been 723 hospitalizations. Ages 0 to 17 made up 15 of those hospitalizations, or 2.1% of the total. At the same time, there had been 14,941 positive cases for all of the state in that same time frame. For ages 0 to 19, because of the way the data was broken up on the DPH's website, there were 3,467 cases of children ages 0 to 19, which is 23% of the total. So I'm not here to argue that there are not cases happening. I feel that cases amongst children is not a good indicator of where we should stand. Prior to any of this, there was always immunocompromised individuals living amongst us. We didn't mandate masks on people to help protect them. It's sad, I feel for them, but there were things that everybody had to do to survive their way around it. And I feel that we're at the stage now of this pandemic where there's a readily vaccine available for people 12 and over. There is when you look at children under 12, I don't feel that the risk to them is any greater than anything that may occur to them. The flu can get to them just as easily. The data that we've seen does not seem to present that it would cause any more harm to them. That's why I went the way I did. As I was looking at the hospitalizations and positive cases earlier, approximately 0.5% of the total cases that happen in children end up in the hospital. So you're looking at 3,400 cases and 15 hospitalizations over the last 2 weeks. Breakthrough cases in Massachusetts. There have been, as of today, there have been 16,000 breakthrough cases, which is 0.35% of the total vaccinated people. 571 total hospitalizations, which is 0.01% of the vaccinated people. And 131 deaths, 0.003%. So to me, the argument was almost twofold. It was is the vaccine available for you? If it is, I don't feel it's this board's role to mandate that. If the vaccine is not available for you, ages 0 to 11, I don't feel the risk of COVID is any greater than the risk, and I don't personally feel there's as much of a health risk with the mask. I know your son, I know you stated your child, and that I don't experience that personally, so I understand your scenario, but for me, I don't feel that the need of the mask, I don't understand the risk that it's necessarily mitigating for a group that of that age. And I guess, finally, part of it, part of me just doesn't know when it ends. If it doesn't end now, I don't know what it takes to end where we're living in right now. At the same time, so DESI's implemented this mandate, the same children are going to be playing together at the YMCA, indoor playgrounds, indoor sporting venues with, as of this moment, no mask mandate for any of those places unless their towns implement them on their own. I just don't know how we come out of this if we don't start to try to come out of it. I was in favor of going back without them and seeing where we were. I've been in favor with going where we are, and maybe someone to call it reactionary. I prefer to adjust as we see things. We saw it last year where there were decisions, do we go full remote or do we not? And we made the decision sometimes to not, where others thought we should, and we wrote it out. It's not, I don't know if there's a real right or wrong answer. I think part of this is anybody who thinks they know everything is right or everything is wrong, probably, I don't think you can. I don't think any of us know everything right or everything wrong at this time. Maybe the sooner we all see that, it may help us all get to a better place, but that's probably beyond this board. So in the end, so I'm not here to argue that masks don't work. I do believe they do. I don't know to what extent, clearly. However, would it lessen the risk of a child getting sick? I think it would. I think we saw last year that it would. However, I'm not willing to go to the extent to implement that because I don't feel that's our role in this. The flu vaccine has been proven much less effective than the COVID vaccine, yet prior to COVID, we didn't require our students and staff to wear masks to prevent the spread of flu or any other common cold. So that's why I chose to vote the way I did. I gave, which I'm not going to get into now, but I do have ways that would make me change my mind. So I'm not saying I understand parents' choice has been out there, and I think most of the parents may choose to change if they had the same things come to happen that were in my head that would cause me to change my mind. But that's why I just wanted the time to be able to talk to everybody, talk to people on TV about why I felt the way I did and why I still feel the way I do. So thank you, Wendy.
Thank you, Chris.
So, I was going to save some of my feelings about this till we kicked off the presentation after this vote, but I feel like the committee's sort of, shared with you how they feel, and so I owe you that. I'm your superintendent of schools. I can't, it's wrong for me just to be silent. So, I've listened to 1,000 people on this side, I've listened to 1,000 people on that side, we all have. And I'm confused by all of it. I'm just being blatantly honest with you. There are experts lined up on both sides of this. And I don't have the freedom to decide who is right and who is wrong. We're not talking about the Schaefer kids here, we're talking about your kids. And I respect that you're parents and you have strong feelings about what's going to happen with your kids. And in the end, I always worry about all your kids. Believe me, I worry about my own kids. I'm a dad. But it's funny, I can't say I worry about your kids more. I worry about your kids differently, if that makes sense, because I feel a great sense of responsibility for all of them. But I can't pick a side on this. I'm not qualified. I do like algebra books and teachers and pencils and back to school stuff. I don't do epidemics. And I've been trying the best that I can with a group of people that just want to get through this for you with your kids. The Abington Public Schools administration and faculty and staff are steadfast to do, we care about their social emotional. I mean, we care deeply about it. It's been an initiative and something we've worked on. We're not going to raise healthy individuals if that's not in place for your kids. Tonight, we're all wearing masks because the commissioner said, effective now, you all gotta wear masks. So that's why we're here, and that's why a lot of the people here in this room are wearing them. I hate masks. I don't wanna wear one. I'm probably speaking for everybody. I'm gonna go on a leap of faith, but I am. And, the bottom line is I wasn't given the choice. I don't get a vote. The letter came out, the committee supported, it felt like what the community wanted to do with the parents' choice, and then that was removed from all of us. And I'm being open with you and honest with you. The problem I see going forward is, you know, we're gonna have to require that people wear masks in the building. And that's just the way that is, because I don't get the right to choose. In terms of enforcing that, I worry, because I worry about the social emotional piece. I worry about a kiddo who comes to school who just won't or doesn't want to wear a mask, or the parents drop them off and tell them, you know, say don't wear a mask. Ultimately, we're just not allowed to have them in class. So ultimately, and I don't know what the policy is going to look like, I don't know what's going to happen, you know, until we have that conversation. We'll check with other districts and find out what they're doing. I mean, believe me, that's probably the only thing I'm going to work on for the next 24 hours till we get that figured out and I get a recommendation to these people who will deliberate and lose sleep on that policy. But in the end, I don't know how they're going to stay in school if they're not going to wear a mask. And we'll be gentle about it, we'll be thoughtful about it, we'll offer them a mask, we'll try to keep them here, but they won't be able to go to class without a mask. And I know people don't want to hear that. That's what we're going to have to do.
Wendy, stop it.
I'm being honest with you, open with you, and that's pretty much what I wanted to say.
You guys, I promise you, we will get you the information you need as soon as possible. Right, but this isn't, we just got, no one's more frustrated than me, trust me. I'm sitting here without a mask. It's expected that, I have no idea, I was, I wish I knew. I asked my husband if we could move to Florida, and he won't. I fight every day for you guys. We all do. Everyone feels differently, but everybody is representing somebody here. So.
Could I ask parents, you also use other avenues to voice your concern?
So she shouldn't be answering anything. All right. Yeah. Beth. Beth, I agree, and actually nobody from this committee should even be answering anything to somebody unless it's Peter or I, because I'm the chairman and Peter's the superintendent. So nobody should even be answering anyone without coming to me first, or to Peter. So unless they totally know what an answer is. Upon statistics that were given, I actually wanted to give statistics that I was given. I did ask Peter to ask the Board of Health agent, and we were just sent like a bunch of links to the COVID dashboard for Massachusetts. So luckily, we have other people that are willing to dig deep. So I just wanted to give you guys a breakdown because I think it's deserved. So the total positive cases in all of Abington schools from September 16th to June 17th were 229 cases. The Abington High School had 72 students and 5 teachers out of 624. All were masked, so that's 552 healthy students and 88.46%. I'm going to get to that. Abington Middle School had 54 COVID students, 10 teachers out of 644 students. All were masked, so that's 590 healthy children with 91.61%, or 91.61%. Woodsdale School had 25 students, 2 teachers, for a total of 307 students. All were masked, with 282 healthy students, or 8.4%. 81.4%, excuse me. Beaver Brook School had 39 students, 15 teachers, that got COVID. The total students are 505, all wore masks, and there were 466 healthy students, or 92.28%. For preschool, there were 2 students out of 53, 5 teachers, most were masks, and so that's about 51 healthy students, because some move and everything, so that's about 96% healthy students that we have. For summer school, we had 123 students in the special ed ELE program, and we had 63 who attended the secondary summer school program. None were masks, and all were healthy at 100%. So as of today, I know we have a few students in quarantine and some positive students as well, and that majority is within the past 7 to 10 days. So also just wanted to point out that there were 552 comments on an opinion poll in Abington. My count after sifting through all the comments was about 160 participants. 30 wanted to have masks in school, and so that's less than 20%. And that includes immune-compromised children, parents of immune-compromised children as well. So there is no right answer to any of this. What's that? So those numbers, whether they were masked or unmasked, you said they were masked, that's not... Okay, well, the majority was masked. That's not necessarily true, because I'm the one that provides the data, and that was not given to anybody, so... Okay, so I don't know how the exact number of masks, but you can kind of get the gist of it, parents, of where we're coming from. So, but that is up to DESE, because they made a state mandate. Had they not, and just did a mandate for maybe inner city schools or cities or, you know, towns that are really big like Framingham, I have no idea, but I do think that Abington is different. However, we play sports and do other things with other students in other districts, so that's something that has to be considered. So that's where we're at this point, and at this point, I guess we're going to finish out with the vote. Oh, I'm sorry, I didn't hear you. Oh, I asked that, 0. I'm sorry, no, yeah, I didn't answer you, but I did ask. That I don't know, it's unfortunate. I absolutely agree with you, but again, that portion of it is out of our hands. Well, actually, it was...
Wendy, can I ask that we move on to the motion at this
Sure.
point, please?
Absolutely.
That's not true, sir. You had a chance to come up and speak for public comments like everybody else did. The argument isn't getting us anywhere.
What I was actually trying to say is, since I'm on the subcommittee, that I was going to try to ease the disciplinary action if possible. So, but anyway, let's continue with the vote. No,
I don't.
he works for us, so he has to do what we say, and we work for you, so we have to do what you say until DESE gets involved, then they rule. You guys, I sent emails to the Board of Education, I sent emails to DESE, I called DESE in screaming, I am just as frustrated. I feel the same as you. I'm saying the same thing. I'm not sending my kid to school with a mask on. But unfortunately, she's a teenager and really likes sports. So she wants to put on a mask if that's what everyone else is doing. If I had a little one, I'd say no way too. I don't know what else to do. Our hands are seriously tied. And all we can do at this level is work on the disciplinary action. And that's our next step. No, because behavioral children and children with medical issues automatically get to have a different discussion with the schools. It's the other kids that... So, but this is what we're doing right now, is rescinding the old policy, because it's no longer in play. It doesn't mean anything, so we have to try to get it off of our books so that we're putting this in Desi's hands. So, you made a motion, I seconded.
Yes.
All in favor?
Aye.
Aye. Thank you. Okay, so now we're going on to the opening of school presentation.
So, again, we'll give you everything we have. We're not going to be able to answer all your questions or satisfy some of the concerns tonight. Probably the best way to do this, if the committee doesn't mind, Felicia and I can work the microphone here. Rich could put the presentation up on the board, and you'll have the committee has a microphone so that you can, if you want to interrupt and ask us questions as we go, we'll do whatever we'll go wherever you need to go with it.
So we're moving that way, right?
Yeah, we're going to go sit down there, and why don't we all just hold our questions, if you can, just bring down a pen and paper until the end. That way it would just go smoother, if that's okay.
We can't sit up there because, as you'll see in a minute, that light's going to be in everybody's faces. So, as I said, you've been getting this information real time, basically the way we have been. We've been through the timeline a number of times. Today at 3:30, we received from Desi, if I could start with the next slide, please. The mask will be required in all school buildings at least until October 1st. After October 1st, if the school demonstrates a vaccination rate of 80% or more of students and staff, then vaccinated individuals in that school would no longer be subject to the mask requirement. Students and staff will be required to wear a mask in school, and school buses and also vans. This is the information that we were provided at 3:30 today. A student day, and this is, we had a number of parents talk to us about social emotional. Obviously, this is not normal, and I'm not going to tell you. So I'm going to try to get through the presentation for you. So we're going to try to group students the way that you all remember as much as possible before COVID, working in groups, interacting as best we can. There will be also, though, at times the need for us to do the quarantining and the close contact work. So we're still going to have to keep track of where people are so that we can do that work. But we want to get as close to normal as we possibly can. Again, knowing masks aren't normal. Students will be unmasked while eating in cafeterias, and they'll be set up 3 feet apart. At least the chairs will be set up in the same direction. The purpose for that, sorry about that, and then Felicia's going to have to adjust it down probably. The reason for that is because that's when nobody has a choice to wear a mask or not. At lunch, they have to take the mask off to eat. So we've got to spread them out as best we can in the cafeterias. There's different ways of assigning kids seats so that they can sit next to their friends. We're especially at the secondary level. At the high school, I talked to the principal today. The students are just be able to pick where that assigned seat's going to be. At the middle school, once the kids understand how the cafeteria works, they're going to be able to pick their assigned seat. And then at the elementary levels, they really sit by class. If a student is required to be absent from schoolwork and assignments and makeup work will be provided as we can. A lot of that's dependent on the length of absence. It's also dependent on what was covered in the class. You can't make up, if we're doing things the right way, you can't make up what's going on in the class. The best example is probably a science class. If there's a quiz, those types of things can be provided to somebody who's not at school, one way or another, either electronically on paper. But if you're doing a science lab, you absolutely have to be there for that, and the students will have a chance to make that work up. Where are we?
evening. I'm going to talk a little bit about COVID protocols, some of which are the same as last year and some of which have changed. So the COVID-19 symptom list is the same as you've seen in last year. The difference is the top 4 are highlighted, and if someone has any of those symptoms, then they need to isolate and be tested. And if they have those that are not bolded, then those would have to be in conjunction with other symptoms. And our nurses will help with that, looking at the symptoms if you need help with that. And that's important because of the next slide. So if you're unvaccinated, or if you've been a close contact and you present any of the symptoms that was on the previous list, then you would follow the testing and protocol, quarantine protocol that was in place pretty much last year that you're familiar with. If you've been vaccinated and you are not a close contact and you have any of the symptoms that were bolded, then you should seek medical testing and quarantine until you know that you are negative. And if you have the symptoms that were not bolded, then you don't need to quarantine, and you may want to speak with your physician around that. The protocol for if someone tests positive has not changed. If you test positive, you may return to school after 10 days. If you have no fever for 24 hours and you experience an improvement in symptoms. The definition of a close contact hasn't changed. However, on the next slide, I'll explain the conditions that will exempt students and staff from the testing and quarantining. So for those fully vaccinated, asymptomatic people that are identified as a close contact, they won't need to test and quarantine. If there's an exposure in school where both of the individuals were masked and they were spaced at least 3 feet apart, they won't need to quarantine. So if you remember the definition of a close contact, 6 feet for 15 minutes cumulatively. If they're both masked and they're at least 3 feet apart, they won't be considered a close contact. School bus and van riders, as long as they're masked and the windows will be open on the buses, they will not be considered a close contact. And anyone that's had COVID-19 in the past 90 days and is without any symptoms also won't be a close contact.
Excuse me, how are you going to know the children that have been vaccinated from the children that haven't?
So we can check student vaccination status.
Okay, that's a violation of HIPAA.
It isn't a violation of HIPAA. We have documentation from the Department of Public Health that our school nurse professionals are able to look up student vaccination status as they can look up other vaccination statuses.
And who's going to have this information? Just the nurses?
The nurse and an administrator. It's not something that is shared, vaccination status.
And then the kids will be pinned against each other, versus vaccinated versus not vaccinated. That's what this is called.
So, I'm going to move on. Students will continue to contact trace for those students and staff who are in close contact to someone that's positive for COVID-19. That will be done by the Abington Health Department, our school nurses, and our administrators. But again, students will be may be mixing throughout the day. They won't be in cohorts as they were last year. So we will take our time to contact trace and make sure that we identify those people that were close contact. If you are close contact and you're unvaccinated and asymptomatic, the Department of Public Health, in conjunction with the Department of Elementary and Secondary Education, have developed a program called Test and Stay. So if you have been identified as a close contact in school, you don't have any symptoms of COVID-19, you can come to school and be tested. So you'll have to wear a mask at all times, except when you're eating, which we will be, and you have to maintain 3 feet of distance when you're taking off your mask, and our cafeterias will be set up in that fashion. I'm going to talk a little bit about the test and stay program. So if your student is identified as a in-school close contact, if you agree, you could have your student tested each morning prior to them going into their classroom. So there'd be a designated area in the school. Students would come in, whether they're dropped off, walk, or take the bus. They would come into the designated area, and under the supervision of our school nurses or an administrator, will take a rapid antigen test. If the test is negative, they can go to class for that day. They can participate in school extracurricular activities as well. Students and staff that are involved in the test and stay program would be tested for up to 7 days for 7 days after the exposure. So if you're exposed on a Monday, you find out you're a close contact on a Wednesday, you would be tested each day for 7 days, up to 7 days since the day of exposure. It's strongly recommended by the Department of Public Health and Department of Education that when you're not in school, that you would quarantine. If there's a school event on a weekend or on a holiday, there will be testing available for those students who wish to participate in that school activity. For example, if there's an athletic practice on a weekend or a game, there'll be an opportunity to they'll have to test in order to be involved in that activity. And when you agree to be in the test and stay program, you'll also be asked to monitor symptoms for 14 days. I want to reiterate that test and stay is not required. It's something that you may choose to participate in. If you do not participate in test and stay, then your child will need to follow the traditional close contact protocol. So that would be they'd have to be quarantined, can be tested on day 5, can return to school on day 8. Just want to remind people that there is not a remote option for students this year, and and additionally, the results of all COVID-19 tests, positive or negative, are reported to the Department of Public Health.
It's only 8 days now? I thought it was 10.
If you get tested, you can come back on day 8. Day 8, yeah. You can get tested on day 5, you can come back on day 8. If you don't get tested, then you have to be out for at least 10 days.
So if a kid shows symptoms and tests negative, what happens? What if he tests positive for the flu? Are you doing anything about that?
If someone shows symptoms of COVID-19, they can be.
Negative and then test positive for the flu, are you going to do anything?
If they test negative, they can return to school.
Okay, but what if they test positive for the flu?
Then they
They come back right to school? That literally makes 0 sense. 0 sense. You guys are really pathetic. Like, that's ridiculous.
All right, you guys, listen, this has nothing to do with Felicia or Peter. These are guidelines, mandates from the state, okay? I understand everyone's frustration.
If your masks work, we wouldn't need to do close contact.
So do you want to come back up? And
Yes, let's come on back up. Okay, you guys, we're gonna have to have a recess if everybody talks out of turn. Sorry. Let us all come back up, and then we'll answer questions. Okay, thank you. anyone would like to speak, could you just come up and state your name and address and ask your question? Thank you.
Wendy, can we, all right.
Leah, I live in 45 Walnut Street. Who pays for the rapid tests that we're going to offer for as many students that want to take it?
Thank you. I'm not sure I have a mic. Can you hear me?
I can hear.
Okay, you can. The rapid test is paid for with federal funds that are going through the Department of Public Health and the Department of Elementary and Secondary Education.
Okay, thank you.
Good question.
Wendy, can we ask any?
What's that?
Do you want to wait or for us to ask any?
Hi.
With my name?
Yes, please. Thank you.
Nicole Emery, 16 Pond Street. Just a quick question for Felicia, I believe.
Yes.
Nurse?
Nope, Assistant
Oh.
Superintendent.
Oh, okay. Is the testing and stay, whatever that, the new test and stay, is that like an NP swab, the all the way up and back?
No.
Or is it just a
No.
nasal?
Right in the nasal.
So just like 1 inch in, not the full?
Correct.
Okay. Thank you.
Thank you, Leah.
I like that question. I like that question. I like that answer. It's okay, I'll let them go. I have two.
Hi.
My name's Erin Stracuzzi. I'm at 141 West Chapel, and I just have a question. I know you don't have the answers for any disciplinary actions for the children. However, if you were to stand up and protest this, what are the ramifications for the Abington School District? Are you fined? Is your money taken away? Do you know the answers to that?
I know that what the commissioner has done is included this in the time on learning, and so if we don't comply with this, I think, and this is, I'm going to say qualify with I think, what would happen is the time we're in school wouldn't count as time on learning, I think, if we as a system decided to do that. And in terms of time on learning, there's funding connected to that. There's a requirement for the state has to get federal money based on time on learning. So, and that's what I think would happen. You'd end up pushing the school year back. You'd have to add days because the time on learning wouldn't count.
I think she's asking about individual.
Oh, sorry. I thought you meant as a school system if we stood up.
If
Yeah, okay.
you were to stand
Yeah.
up
As a school
and
system, if
say,
we stood up and said,
we don't agree with this.
we're not doing it.
We're not doing it.
Yep.
We're leaving it up to the parents.
Yep, that's what I just described, I believe, would potentially what would happen.
Okay, thank you.
Yeah, and I just want to say, I think most of us said, or a few of us said we don't agree with it, but we understand for the betterment of the school department that it's something that we need to follow.
I do have Desi's guidance on discipline, and it says, whether and when a student should be disciplined for failure to wear a mask is a local decision, guided by the district's student discipline policy and the particular facts. Districts should consult with their legal counsel to address these matters. Districts should provide written notice to students and families about expectations and potential consequences, and are encouraged to use a progressive discipline approach. The mask requirement includes an exemption for students who cannot wear a mask due to medical conditions or behavioral needs. Further, some students with disabilities may need additional supports to wear masks and may need to be accommodated. Districts are encouraged to consider and implement alternatives before resorting to disciplinary exclusion. Keeping students connected with school is especially important this fall as students return to school after a challenging school year. Mike?
Mike McDonald, 3 Pinecrest Road. My question is regarding, getting back to school, and I think it's pretty clear from everything I read, we're expecting a massive flu influx. The swabs in these, they're not even, I think, even close to perfect. We're just setting up for another disaster. I mean, I think that's pretty clear, just from last year's experience coming into this. And secondly, in regards to the vaccination, I would wholeheartedly disagree down to the gentleman in the end. Children, for what? For what? Why?
I agree with you. No, I agree with that line of thinking. I told you what my personal belief was. I don't,
Right,
but I
so
don't feel we
13
should mandate that on anybody.
Right, but that's what's coming, right? So we know that's what's coming. We know that the government is looking to control, they're looking to put that on us, right? So it just, we have to have what's called common sense. I'm not, you know, to say this stuff, say we all should get vaccinated, like it just doesn't, it does not add up to the science of what is going on. So we have to be clear when we say stuff like that, that we understand that our children are fine. What we should have done, how we mishandled this whole thing, which is clear to everybody here, which there isn't a person that can't deny that the subsets of people that we should have taken care of, which we didn't. So now we're penalizing again, and it's not your fault. And I'm sorry you all have to go through this. I really am. I know that this isn't, you know, you guys, but we have to have some courage and understanding that these are subsets of people that we feel horrible for, but our children are the ones that are getting impacted. It makes zero sense. It's mind-blowing that nobody, that the whole country, that Massachusetts is not, everybody's not saying enough. Our children are going down. So the flu is what we're going to see, right? So we're going to see a massive flu, and everybody's going to, panic. Our kids they're not dying. So.
Thank you, Mike. Chris, did you have any questions?
I just had two quick questions on the reopening. Number one, so is there such a thing as a close contact if you're outdoors?
No.
Okay. So I mean, because they're not going to have masks outdoors.
Correct.
And okay, all right. And if a student ends up in quarantine for either testing positive or they choose not to partake in the test and stay program, what do we know yet, I guess would be a better way to phrase this. Do we know how they could still continue to work on things so they don't fall behind their classmates?
So we'll have to go back to the traditional way when kids are absent to provide them work, because there's no remote option, or there's no synchronous program this year. Those things aren't counted as time on learning by DESE this year. So it would be similar to pre-COVID in terms of getting students the opportunity to make up work, do what they can depending on the length of the absence, and that could be a combination of things that are online, that a teacher may have on Canvas or not on Canvas, or things that could also be sent home as able and possible.
Okay, yeah, I mean, most illnesses occurred were 1 to 2 days prior to this, though. Now, if you're in quarantine, it's 1 to 2 weeks, so that is, I just hope there's some, I'm sure there will be. That's just something I wanted to hit on.
Anyone else have questions?
I just have a question. Are the same notifications going to go out, Peter, so a parent, just so they know that there has been a case maybe in the classroom, if they want to make the decision to have their own kid?
Thank you for asking that question. It was something I was supposed to say during my presentation. What I plan on doing is doing a weekly rather than a daily update. I think people were clobbered last year with daily updates, and I'll see how that goes and adjust accordingly. We'll continue to update the website with the numbers at the end of every week. I went back to the number of messages that were sent, and it was just, it was overwhelming. So I think a lot was lost in those. So try to do an end of the week summary.
And the state is not tracking cases, correct?
They are, positives, yeah.
Positive in
Oh,
kids?
they're not going to be requiring us to report numbers to them
Report
each
numbers,
week, if that's what you mean, yeah. But
Yes.
I'm sure through DPH, they are tracking,
Okay.
people live in Abington.
So I have a bunch of questions as well, but I'm going to hand them over and let you answer them and have them maybe get back to us on the September 1st meeting. A lot of these have to do with, things that I know were implemented last year, just to give like how recess will look on rainy days, how gym will look indoors and outdoors, how music will look, a music class, will kids be able to sing, how will students be required to wash down their desks like they were before? So I have a bunch of questions, if you could get them answered between the staff and
Sure,
you
I mean,
guys. Awesome.
I can knock some of those out pretty quickly, too, though.
It's up to you.
I mean, music classes indoors, as long as they're wearing masks, are fine. With musical instruments, there's a cover for the musical instrument. If you're indoors, you're going to have to wear a mask, and if you're outdoors for PE, in recess, you won't. I think
Washing the desks?
washing desks, students won't be washing desks. So, but I can
Yeah, go
continue
over the
to
rest
go
of those
through it,
and
but
then-
those are some,
And I mean,
off
the
top.
recess is gonna be like it was prior, I mean,
Correct.
okay.
Thank you very much for the presentation. We appreciate it. I know it's a difficult time right now because, we just found this information out, so it's really a little hard to grasp. And hopefully by September 1st and within the next couple of days, we'll be able to talk to the rest of the districts and see where they're at and get more guidance from the Board of Education and DESE and see how they, what they think about anything that we have going on. Next up is the proposed revisions to the 2021-2022 school calendar.
So basically, the reason for this request is when we published this back in June, when I asked you to consider it in June and then published it, we didn't have the MCAS dates. One of the MCAS dates, especially at the high school level, won't move easily it can't move from May 18th. So we're just asking you to move the professional development day from May 18th, which is a Wednesday, to the following Wednesday, the 25th.
Okay.
And you have a copy of the calendar in your packet.
Would anyone like to make a motion to move the date as requested by?
I'll make a
Peter?
motion.
Do I have a second?
I'll second.
All in favor?
Aye.
Aye. Peter, do you have anything else to add?
No, I just, thank you. This is awful.
Definitely is. I appreciate everybody coming out. Thank you. I'm sorry we don't have better news for you at this time, but as soon as we talk more about what's going to be happening the first day of school and disciplinary actions, we will get right back to you guys and announce it. So thank you for everyone's patience, and can I get a motion to adjourn?
Yes.
I
Do I have a second? Great. All in favor?
Aye.
Aye. Thank you.